Epidural anesthesia for labor.
Pain is considered a normal part of childbirth. There are several different ways to treat the pain of childbirth. An anesthesiologist is a doctor with special training that can work with you to treat this pain while keeping you and your baby safe.
What are the options for pain relief in labor?
There are several different options for pain relief during labor. They include non-medication treatments such as meditation, deep breathing, Lamaze, massage, water therapy, and acupuncture. You can receive IV pain medicine during labor, but this must be stopped 1 hour before the baby is born because it can make the baby sleepy and cause breathing difficulty in your newborn. Another option is numbing medications to the areas around the vagina and uterus. In the United States, one of the most common forms of pain control during labor is the epidural. The epidural is a catheter, similar to an IV, in your back that releases numbing medication to the nerves that carry pain signals to your brain.
What is an epidural?
An epidural is a small plastic catheter or tube that is placed in the center of your lower back. It slowly releases local anesthetic, also called numbing medicine, to the nerves in your back and prevents you from feeling the pain of contractions. Your contractions will continue, you just won't be able to feel them. Epidurals are the most common type of pain control for women in labor. 2 out of 3 women who have a vaginal delivery in the United States receive an epidural.
Who can get an epidural?
Most women can receive an epidural if they would like one for pain relief. An anesthesiologist will talk to you about your medications, medical history, and surgical history to make sure an epidural can be safely placed. You will also have some lab work drawn to make sure that it is safe for you to receive an epidural.
When can I get an epidural?
An epidural can be placed anytime during active labor up until you start pushing. It is fine to attempt childbirth without an epidural and then decide to have one later on during labor. You do not have to be a certain number of centimeters dilated prior to receiving an epidural, and you do not have to know if you want an epidural when you first come to the hospital.
How is an epidural placed?
Epidurals are usually placed with a woman in the sitting position leaning slightly forward. The bottom part of your back is cleaned with a soap solution. A small needle is used to inject numbing medicine into the skin. This may sting a bit. After the numbing medication is placed, you should feel only pressure. A needle is then used to find the epidural space. Once the epidural space is located, a small tube is placed into the space and the needle is removed. No needles stay in your back. The tube is connected to a pump that continuously delivers numbing medication to you. The whole procedure usually takes about 15 minutes, and most women report that it hurts less than one contraction.
What are the advantages of an epidural?
Epidurals have been shown to provide pain relief during labor that is superior to IV pain medications, Lamaze, acupuncture, pain pills, water therapy, massage, and other nerve blocks. Unlike IV pain medications, the medicine in epidural does not make you as sleepy, and it will allow you to remain alert and interactive while your body works towards the delivery of your baby. Some women find the pain relief to be so good that they are able to take a nap during labor until it is time to push their baby out. Some research studies have shown an association between improved pain control that women get with a labor epidural and lower rates of postpartum depression. Currently, about 1/3 of the women in the United States have babies by cesarean section. If you end up having a cesarean section, your epidural can be used to numb the lower half of your body so that you can remain awake and be able to hold your baby after they are born while the obstetrician performs surgery on your uterus. It also allows other family members to be in the operating room while you are having surgery. If you are having a cesarean section and do not have an epidural, you may have to go to sleep, in which case the family are not allowed in the operating room.
What are the side effects of an epidural?
One of the side effects of an epidural is a drop in blood pressure once the pain of labor is taken away. However, this can be treated with medications if necessary. For this reason, a blood pressure cuff has to be worn while the epidural is in place. Other common side effects include itching from pain medication, weak or numb legs, or a small bruise or tenderness at the site of the epidural. There is no evidence that epidurals cause long-term back pain. In fact, approximately 1/2 of women who have babies report back pain afterwards, even if they have not had an epidural. About 1 out of 100 women have epidurals that don't cover all of the pain from labor. For some of these women, their epidural may need to be replaced.
What are the rare side effects of an epidural?
Anytime the skin is entered for a procedure, there is risk of infection, bleeding, and injury to the surrounding tissues. When an epidural is inserted, this risk is very small. You may experience a bad headache that is worse when standing up and better when lying down. This headache will usually disappear on its own without treatment, but every once in a while an additional procedure is required to cure it. There is a small risk, about 1 in 20,000, of injury to a nerve in the area of the epidural. This could be numbness or tingling. It is extremely unlikely for the epidural to result in permanent nerve injury or paralysis.
Will the epidural affect my baby?
Epidurals are a very safe way to have pain relief during labor. Most of the medication from the epidural stays in your back and does not reach the baby. There is no increased risk of having a cesarean section if you receive an epidural. The epidural may increase the time it takes to push out your baby by about 15 minutes. Epidurals are not thought to affect your ability to breastfeed. If your baby does have difficulty breastfeeding for any reason, there are resources in the hospital that can help you.